What about a snake bite?
Snake bites are bad, and I would say that they're extremely uncommon in Michigan until we saw one about 3 weeks ago. They are bad. Even if they're not venomous, they are contaminated. Snakes have a lot of bacteria in their mouth, just like dogs and cats, so almost always they need to be on antibiotics. Rarely, at least in Michigan, do we have venomous snakes, though. Anytime there's a snake bite, they should absolutely be seen by the veterinarian. The veterinarian that's seeing the patient is going to determine if there's a high risk of envenomation, and if so, is it warranted that that patient receive some type of antivenom? It's a million-dollar question. Even among emergency veterinarians now, there's a lot of severe reactions that can happen by giving antivenom. And so sometimes, or actually a lot of the times, when we have snakes or dogs that are bit by snakes, we don't give antivenom. But they should always be seen. They are contaminated wounds. They should be cleaned. They should be monitored very closely. It's not uncommon for them to have large amounts of devitalized tissue that form around those snake bite wounds, and they'll get sloughing of that tissue. Really needs to be watched well. One other thing that'll do that same type of thing, it may not look too bad immediately, but a few days down the road it looks really bad. That's burns. Burns of any type should be seen immediately for immediate care. As much, though, as important as that is long-term care and really monitoring those. Yes?
First, if we get snake bites outside the state of Michigan, where we do have some bad
Sure.
snakes, what would you recommend immediately? That we mobilize or immobilize? What do we do with the dog?
Well, if you've got a snake bite kit, some of the suction kits, etc., you could use those. Their efficacy is debatable, but it's not going to hurt anything. The biggest thing is get them to a veterinarian immediately. I sure would continue working dogs or anything like that throughout the day. And also, if you could identify the snake, that's really important as well. So that means killing the snake and bringing it in, or getting a very, very good, vivid visual description of the snake. That means a lot as far as trying to treat them.
Do you want the dogs to walk out of the field and circulate blood, or do you want to carry?
That's a debate as well. They're going to circulate blood regardless. And so, I mean, that was the whole thing is, you get bit, you want to tie a tourniquet on your leg as tight as possible, don't run, stay calm. I mean, they're up, especially if it's a dog or something like that. Typically, they're excited because they found the snake and they're barking at it. And their heart's going a mile a minute anyway. So they could walk out of the field just fine. Most of the time, even if there's venomous snakes in the area, most of the time they're not venomous bites, or at least a lot of the times. So I would have them walk out, whichever's the easiest and the most effective to get that dog out of the field and get him to a veterinary hospital.